Good evening, and thank you for joining us here on blackdoctor.org. I am really excited tonight to have this program because we have not done this program in months for a myriad of reasons. That's a whole other show. But we are here, and this is House Call with Dr. Gigi. So if you remember this, or you remember Dr. AKA Auntie Gigi, we are back here. And so we're so happy to have this program with you tonight. And I think it's very, very appropriate. So before we get into the topic and our guests and everything we got going on, I have a couple of things I need for you to do. Number one, drop in the comments and let us know where you're watching from. We always like to know where people are watching us from all over the country, all over the world. We've had some people from South Africa and Trinidad and Tobago and Nigeria and everything join. So just drop it in the comment section and we'll give you and your city a shout out. Number two, if you know somebody that needs this information, share it on your page or tag them. We'd like to get this information out, especially what we're going to be talking about tonight, because it's very serious. We've had a lag for 2 years. Don't want to start talking about it just yet. And number three, what I need for you to do is the third thing is share it. Oh, if you have any questions, if you have any questions, make sure you drop those in the comments because we want to answer all the questions that you might have about tonight's topic. So those are the three things I need for you to do in the beginning. And at that moment, I'm going to say, good evening, Dr. Gigi. How are you doing?
Why, good evening, Mr. Ellis. It is so good to see you again. Do you know that we have not met in person yet? Isn't that crazy? Yeah, we've not met in person, I don't believe.
No, we have not. And I've been invited to DC in November and I'm gonna get there.
It's kind of crazy, actually, if you think about it, these relationships that we have. But I think there's nothing better than to see people in person and to hug them. But this is the next best thing. So it's so good to be back. Yes, we've been very busy. You know, we started that State of Black Health, which I'm so excited about that. That's been very powerful. Just a little bit ago, we had the Men's Health, Summit special. Yeah, which I thought was very powerful. And for those of whom I have shared my cancer journey, I'm doing great. I'm cancer-free, thank God. And just before we came on air, I wanted to just tell you that I went with Dr. Lang, our guest, to the Kennedy Center's Black Girls Rock, which featured India Ari. So for your health, your emotional health, your spiritual, your physical health. I mean, I think that she is so wonderful. I swear it was a tonic for the soul. And she was so uplifting and so positive. So in these days, I think it's important that we kind of shut down some of the negativity and focus on those things that are going to be uplifting. I mean, I get caught up just like everybody else and reading the news and everything, but she was so amazing. But I'm excited about today's topic because, all we talk about are COVID. Mm-hmm. I know I'm sick of COVID. It's still an issue, unfortunately. There are the vaccines and vaccines for children. It is important to stay masked. There are all kinds of outbreaks of different variants. And really the people that need to think about getting a fourth dose, if they haven't already, are those people that have various health conditions or are above the age of 65. But those are the kinds of things that you can either go to the cdc.gov website or talk to your doctor or clinician, nurse practitioner, physician's assistant. So that's about all that we're going to say about COVID today.
Yes.
Because you know what prompted us to do this show, Mr. Ellis? A couple of weeks ago, in 1 week, I had 5 people diagnosed with cancer, including one woman with triple negative breast cancer. Wow. And it got the two of us talking about, we need to kind of remind people that there's other things besides COVID, right? And that we need to catch up. So we decided to just talk about family summertime checkup. And I think, if you don't mind, can we bring in special guest, Dr. Nicole Lang?
Absolutely.
So let me tell you about Dr. Nicole Lang. She's very special to me. Not only is she a dear friend, but she was my student at GW Medical School. And then she went to Emory down in Atlanta to do her residency in pediatrics. But most of all, she is just a dear, dear friend. And she's my go-to person when I have any kind of pediatric questions because I trust her. And she, years ago, she started a program in her practice where she would give families books to read to their children.
Mm.
Reading at an early age, and she can speak to this more, helps to just get the brain connected, and it just
Right.
is a good thing for both the parent and the baby both. So she is just somebody that I really admire a lot, and I am happy and proud to call her my friend. So welcome, Dr. Nicole.
Thank you so much. I
Yeah.
really appreciate the invitation, and I'm so happy to join you all tonight.
Yeah. Well, wonderful. Well, I don't know, Mr. Ellis, should we jump right to it?
Let's jump right to it. And the background is this, and Dr. Gigi alluded to it. So there are a number of checkups and immunizations and screenings that we all need to get at different stages of our lives. When we had that word that we're not going to talk about anymore tonight, when that happened, everything got put on hold for 2+ years. And so we had offices shutting down, had limited availability. We all got a little scared and went and just we all became kind of hermits. Those of us that could, those of us that were working on the front line, just kind of braved it, put on a mask and went to work. Because we know that the population that we deal with, this program, Black and brown folks still had to go to work. A lot of us still had to go to work. And so it was a luxury to be able to work from home.
Yeah.
So, but as Dr. Gigi talked about, those illnesses didn't stop. Cancer didn't go away. Flu didn't go away. It went down a little bit, but it didn't go away. And there's a number of illnesses and ailments and conditions, particularly when you're stuck at home, that can be exacerbated. So what do I mean by that? That means if you're a pre-diabetic and you're sitting at home and you have nothing to do and you start eating a lot of different foods, that may push you over the line to becoming diabetic. If you're borderline hypertensive and you're eating foods that are kind of comfort foods that, as we are kind of sequestered from each other, it could push you over to have high blood pressure. So there's some things that those are just a minor, and then there's more serious things like cancers that could start happening and we're not getting our screenings done, and then we have a problem when we do, and it can be further along than it would if we'd had our regular screening. So that's the impetus of this conversation tonight. So we're going to start, and we've got a pediatrician here, so let's start with the kiddies. All right, so Dr. Lang, let's go from birth to 5, because kids need a lot more, immunizations and things like that. So I can't even go a 10-year stretch. We got to go a 5-year stretch. So 0 to 5, what should children be having, whether it's a screening or an immunization during that time sprint?
Right. Well, and let's just start actually with the first year of life, because in the first year of life, I actually see a baby in the first week of life, second week, first month, the second, fourth, 6th month, 9th month, 12th month. So those are just the well visits with monitoring their growth and development and getting their immunizations. And during the pandemic, there were many babies that missed their routine vaccinations, and we had to play catch up on that and make sure that they were well and healthy and make sure they're growing and developing well. And virtual visits is quite limited in pediatrics because you can't actually test all the developmental milestones virtually all the time. You can have the mother or father put the baby in different positions, but really you can't tell if they have low tone or their muscles are developing fine and their brains are developing fine. So there's a lot of dimensions that have to be addressed in the first year alone. But even after that, we see babies at 15, 18 months and 2 years, 2.5 years, 3 years, starting the annual visit. So there's a lot of visits that are just in addition to sick visits that, again, with things other than COVID, that come up, especially in the pediatric world, if children are in daycare and they share their germs freely. And, and so many visits come repeatedly when children are around each other. And so that has to be addressed too. So there's a lot of other things that I also observe, the interaction between the parents and the children and how we screen for postpartum depression in mothers and fathers, but mothers primarily are affected, and also helping moms with lactation support. We have a wonderful lactation consultant in the office, and with this formula shortage, more moms are breastfeeding. But if you can't for some reason, again, trying to make sure that babies are getting the proper nutrition. With the pandemic too, I saw a rise in childhood obesity, even in the younger years, but especially in the teenagers. I actually do a separate visit, preventative visit. I call it a healthy lifestyle kind of smart, healthy choice visit to focus on not just a number on the scale, but our children and families, parents, grandparents included. Are they helping each other, one, holding each other accountable? And I'll tell you a story in a minute about a patient today about that, but holding each other accountable and eating healthy and exercising some way, shape, or form. Even if we're not going outside, we can still do things inside. And are we taking care of each other, from a social, emotional perspective too, and staying connected? Because there was a rise that I saw in my patient population of depression, anxiety, and just other mental health concerns, even suicidal ideation and attempts. So,
And just as a quick aside there, parents, mental health issues, anxiety, depression displays differently in children, right? And so we have to recognize. So please go to sites and things like that to understand that what you might not think what your child is doing, the outbursts, the acting out, things of that nature, that child might be depressed, but they express it differently. So we have to make sure that we understand those things and we can recognize those signs when it's happening in our children, particularly during the pandemic cycle where they're being isolated and not having as much, peer interaction.
Right. Connection. Yeah. Absolutely. They may present as headaches or stomach aches repeatedly with no organic reason for it. And the stress they're holding onto is presenting in different physical symptoms.
And I wanted to just say that, it's true that people didn't go to their doctors or physician's assistants, nurse practitioners, but what that's done is it's actually created a huge backlog.
Right.
And so, for example, I actually had to reach out to Dr. Lang to help me with somebody whose child was suicidal and could not get in to any of the treatment centers around the city. So that's something else. And then I just want to kind of bring in special populations, including disabled children or special needs children, because what we found is, through our work with Rod and where we have partnerships, is that those families were under such duress because people that would normally come into their homes to help out were not able to come, and the parents just were doing everything alone. So, and then imagine if you're coming from, a community which does not have the resources, it was like a triple whammy. Right. So really, I think, I just love the way, Dr. Lang, that you're talking about the family unit, because I think too often we kind of separate it, but it's the whole family, right?
Absolutely. It's a critical a thing to just think about. Just from my perspective as a pediatrician, I always take the mindset of family-centered care, even though I'm a pediatrician and trained in that, and adolescent, newborn through 21, actually, I see. But the family is so important because the child is not in isolation. And so I think that's something to remember.
Yeah.
I ask parents too, have you had your checkup too? And have you gone, get your blood pressure checked and get your screenings done? And, I was like, you're good about bringing your child in, but are you going? Oftentimes parents will take their child, but they neglect themselves. And so I remind them to make sure they go too.
I love the fact that you mentioned well visits, and I think as adults we tend to get away from that, right? So we take our children. You bring in a good point. It's like we take our children for those well visits because just making sure they're getting a checkup. But as adults, we stop doing it. The only time we go is maybe if we're going for our annual checkup, but people aren't even doing that. They're just going when they don't feel well.
Right.
And at that point in time, that condition may have been exacerbated, that could have been caught if you had been going on for those well visits, going to make sure that you're getting all of your labs checked on a regular basis. You know, it may have been caught earlier because, you know, when you have symptoms, it's been in your body for a minute.
And there are some things that everybody should know, right? Your blood pressure, your weight, your height, your cholesterol. But we'll come back to that in terms
Yeah.
of adults. But
We're still at 0 to 5 right now, so we
Right.
That's right. That's right.
Right. So there are some screening blood work labs that are done too. When the newborn stage, it's the newborn metabolic screen that's done initially at day 1 or 2 of life. But then at age 1 and age 2, there's routine screening labs that we do the complete blood count, checking for anemia, a lead level, because some environments have lead exposure, and that can impact neurologic and brain development. So that has to be checked. And then we do tuberculosis screening. And so those are in the first few years, and later on in teenage years, we do other screenings that we'll talk about later. But I just think it's so important to see how a child is developing too. So their cognitive development, their social emotional development, which is just as critical as their physical development. So, and looking at how they're growing on the growth chart, that's very important too. We check in the first 2 years their weight, height, and head circumference, and monitor that to see if there's any change in that. And if they're not physically there in the office, that was even harder to assess, to do.
Yep. So I see that there are people that are in Texas and California and Nigeria that have jumped on, which is great. So, you know, can we talk a little bit about vaccines? Because I know there was a lot of discussion in our family when my nieces and nephew were kind of, you know, early teens about the HPV vaccine. And we know that the HPV, I cannot talk today, you know, that vaccine to prevent cervical cancer, but also cancers that can occur in both boys and girls that are related to HPV, is that the acceptability of it is not as high in African American, Black and Brown communities in general. So can you talk a little bit about the safety of that vaccine and why it is important for young people to get it, children to get it?
Yes, absolutely. So that is the vaccine. And actually the age to give the vaccine has been lowered. It used to be just at 11, but now you can receive it at age 9 and 10.
Oh, wow.
And, but we routinely give that vaccine. And I think it's very important. 1, it's very safe. 2, it's been around for many, many years. It has not been recalled. And in fact, it's been expanded, the human papilloma virus coverage, and it prevents many different types of cancers, and cervical cancer being the main one that we're talking about. But it is very important for boys and girls to get it. I think initially when it first came out, it was, I think, targeting girls, but really in retrospect, and after they kind of reflected on it, they did target both girls and boys. And I think that's important. And I do tell parents of both that we should vaccinate against that. And I recommend it. And I also say, you know, I have given my own, if someone's vaccine hesitant, I say, I've given my own daughter all of these vaccines. I said, if I had any hesitation, I wouldn't have done that. I said, what I do for my daughter, that's what I do for your child, because your child is like my child.
Exactly. And, you know, we're seeing a rise of head and neck cancers, which are related to HPV.
That's right.
Partly because of oral genital contact and sexual habits. But that's why it's so important to get both vaccinated, right? Both genders.
Correct.
Yeah, I think that, you know, unfortunately, because of the politicization. Okay, I'm like, you know, it affected me.
It's the end of the day, right?
So of the COVID vaccine, that when we hear that word, we start to recoil, right? And really, these are immunizations that have been around for a number of years and are extremely important. That HPV one, The numbers are down, as you said, particularly in Black and Brown communities, and it's so very important. But it's seen as voluntary, right? And it is voluntary because it's not required for school per se. It's not required in many areas, but it's so very important to keep us safe from. And really, why wouldn't you want to take something that is safe for your body and is going to protect you from viruses that are out there? It just makes sense. But again, because of all that was swirling around the COVID vaccine, we all are starting to question everything else on the spectrum. So, and I've learned, Dr. Lang, there's about 14 to 16 different immunizations that children can receive.
Right. It's the DTaP, polio, Haemophilus, influenza type B, the pneumococcal, the hepatitis B, hepatitis A, the rotavirus, the HPV, the Menaxa, remember? Yeah. So, and I think it's important to know that most of the vaccines in babies are given in the first 18 months. And the boosters are given at age 4. At age 4, they get boosters of DTaP and polio, and also the MMR varicella. So MMR varicella is given at age 1 and age 4. Okay. And then at age 11 is when we bring in the HPV, the tetanus booster, and the meningitis prevention shot. And there's 2 different types of meningitis prevention vaccines.
So I just want to come back to the link between vaccines against viruses like hepatitis B, because when you get vaccinated for hepatitis B, guess what? Liver cancer goes down. And that's one of the very difficult cancers to treat. So, we know that there is that link, and that's why it's important to make sure that we vaccinate. And, I think as we get away from the polio epidemic, which was, in the 50s, and people were becoming paralyzed as a result, when we don't see those childhood illnesses, we say, well, it's not that bad, but that's because we have the vaccine.
Exactly. Right? That's the argument I say all the time. Well, we don't see them because of the vaccine. The vaccines are the number 1 public health preventative success story we have.
Yep.
Exactly. And I would just say, try traveling. If you don't think that you need vaccines, try traveling outside of this country. You'll see how many you need. And because of that, it lets you know that we're still not even getting enough. There's still more that we could be getting. We're getting the minimum amount here just to keep us protected. And so there's been a number of scientists and doctors and people have really researched this to help protect us. So let's lean into those things that are there to help us instead of recoiling from them and trying to add some nefarious kind of motive to it.
So besides, I wanted to ask about going back to school. I know here in DC, and I would imagine that in most jurisdictions, you have to have proof of vaccinations to get a child to go to school. Is that true in most of the country?
Yes, it is. And in addition, it's not just vaccines. They need an updated annual physical. And a form needs to be completed by me, signed and dated, a recent physical within the last year, or they are not allowed in school.
So it's already July, so
I'm very busy.
And it's not just for sports, parents. It's not just for sports.
No.
It's for participation in school. So I think a lot of times parents confuse it, think, oh, he's not playing in sports or she's not playing in sports. So I don't need to get that physical. No, you need to have that physical every year, and it's got to be
every year.
My son's school, we just upload that document and they're scan it in and upload it. Sometimes you have to do it in person. It just depends on your situation. But it has to get done for them to attend school, not just participate in sports. I want to make that distinction.
So can you tell me, because you mentioned the weight being more of an issue, I mean, obviously we have to be very sensitive in general to people such as myself who are chunky and were chunky as a child, because you don't want to make it, an issue where you're shaming the child, but at the same time, you want to talk about health habits. So what is that like? And what are some of the guidelines that you share with the kids themselves, as well as parents and families?
Yes, no, I get the children involved directly, and I also have the parents involved. And one data point that you can look at is the growth chart that I mentioned, and to see where they are on the growth chart and over time, what the trend has been and what their BMI is. And before even that point, just asking about their health habits and what they're eating and drinking, and if it's sugary foods or drinks. And like, for example, the patients I saw today, it's two siblings, 12 and 14. I saw them for their well visit a few months ago, and they were both overweight. And so I said, we have to come back and focus on this particular issue because I'm concerned and I want to make sure you're as healthy as you can possibly be. And so that's when they're coming to my healthy lifestyle, positive, smart choice visit. And we don't call it an obesity visit. Okay.
Right.
And so we had talked at the former appointment about some things we can do regarding the foods we're eating, the portion sizes, types of exercise, what they enjoy doing, not me telling them what they like to do, but I want to hear from them what are the choices that they like in terms of the different fruits and vegetables and types of exercise, and are they getting also enough sleep? And also, we talk about at that visit too, like stress and mental health concerns, because some people will also comfort eat, and they're picking the wrong foods to comfort eat, right? And figuring out, but before they leave a visit, we talk about what are some behavior changes that we can implement and what is doable for them. And every teenager has a cell phone. So I say, go to your notes section and I want you to write down a list of 5 things that you can do. And then let's also like hold each other accountable and make sure that we're, 1, making a behavioral change, but 2, also being consistent with it. And so that's why I don't wait a whole year to see them again. I will see them like every 4 months and do check-ins, and we check their blood pressure too. We do screening lab tests for cholesterol, diabetes screen, thyroid screen, because sometimes it can be a thyroid issue that's causing the weight problem, or they could be pre-diabetic. And so we can talk about other things to prevent that, and take the family history too and see what diseases run in their family. Do they have high cholesterol in their family? So my job, I feel, is trying to be preventative before they get out of my venue at age 21 and go into the adult world. And I'm not sure if they're going to keep going to their annual physicals like we just alluded to, but, I try to emphasize, healthy habits are lifelong, and that the reason why we're doing this is so you can be as healthy as you possibly can be. And so we do talk about some concrete examples and not just say eat healthy. We talk about maybe smoothies like with spinach and different fruits, and frozen fruits can last longer than fresh fruits, and add water to it, and making sure we're not doing sodas and juices. I say, if you want apple juice, eat an apple. You want orange juice, eat an orange. You want grape juice, eat some grapes. Okay. And don't get the sugary juices. And actually today, the family that I saw, the mom is also struggling with weight concerns. And we mentioned about food choices, and the daughter said, yes, I had my mother put down that bag of Cheetos and told her to get a plum. I said, well, good.
You bring up a great point, because when you educate children, do you know that I prevented myself, my sister and brother, prevented my mother from being a smoker, because we had gotten educated about smoking. So when she started to pick it up, we would just throw it in the incinerator. And so she actually never became a smoker, and both her parents died of smoking related illnesses. So I think children keep us honest, and especially when they've learned some things, and keep it real for us. And
right. And there was a weight change from from the visit in February to now. Like, they both had lost some weight. It was maybe like 7 or 8 pounds, but that was a big deal. And so
that is a big deal.
Congrats. And I focus, I said, it's not just a number on the scale. I said, these are lifestyle changes that we're talking about, but look at what you did. And I'm very proud of you and the changes, I said, that you have implemented. I said, you all are old enough now to be involved in grocery shopping and helping to cook and helping with the preparation, and, understanding why the foods that you eat are very, very important. I said, good, the proper good nutrition is like good medicine. If you say you eat the right food, you don't need medicine from me per se. Right.
I think it's important. We do a number of shows here on Black Doctor. We've got our veganist show that we do on Thursday nights at 8 o'clock, and we talk about eating a more plant-based diet. And so we kind of give people some tools and techniques on that. Then we've got Health and Wellness 360 that comes on Saturday mornings. And one of the things that our hosts talk about is like sometimes when you think you're hungry, you're really dehydrated, right? And you're really thirsty. And so what we try to do on those programs is teach people replacement behaviors, right? Because it's hard to just go cold turkey. I'm not going to eat this. I'm not going to, eat it. I have my weaknesses. Dr. Gigi, she's talked about her weaknesses to chips and potato chips. I know that. So we get it. Mine is hot wings and French fries. So I get it. So I'm with you. But what I've done is replace some of those repetitive habits that we have formed over years with something different. So when I feel that craving and I want to go down and get that small bag of chips or something, I grab a bottle of water and I drink it. And while it's not as satisfying as that salty deliciousness that comes on those chips, it is satisfying mentally, because I know I'm doing something better for my body. And if I develop that habit over time, then I'll reach for something healthier. And I don't want to feel that anymore. I'll reach for some fruit. I'll reach for a healthier snack. And then that habit tends to build upon itself. And you notice you'll start feeling better. Your sleep habits will change. And then you'll become more regular. So those are things, but we can't just go cold turkey. And that was the thing when I working in counseling, I worked with drug addicts and I would say, what are you going to do to replace that drug seeking behavior? Because you can't just stop, because that time is not going away. That time that you spent seeking drugs is not going away. Just like that time we spent snacking and preparing food and going to the fast food spot, all that time that we get back from not doing it, what are we going to replace that with? Otherwise, we're going to fall back into our old habits. So we've got to replace that with healthier, better habits.
Yeah. Can I tell you what I've switched to from chips? Because, obviously, I think I need to come to your lifestyle clinic, Dr. Lang. But I've actually found celery sticks.
Yes.
That's a praise report. We got a praise report.
So I actually put them in my fridge. They're already washed and clean, so I could just grab them when I'm
dip them with hummus or something.
Right. But one of the things that in terms of checkups for children, which unfortunately can be a cause of just heartbreaking deaths, are drugs and alcohol and tobacco. So what do you do? What has been shown to be effective in preventing kids from starting? Because vaping is cool and, that may be a gateway drug to other things.
Right. So I think, it starts before they're teenagers or even preteens and exposed to this. It starts with when they're able to even understand the choices that they make, and to make the mantra in my office and at my home is like smart, healthy, safe choices. The choices you make matter, and the choices have to be smart, healthy, and safe. Right? And if they are choosing different avenues, then that will impact their health. And, I say for alcohol, like for teenagers, I was like, the drinking age is still 21. How old are you now? Right? You're not 21 yet. Right. And this is what it can do to different organs in your body. And it makes you more of a potential victim in certain situations if you don't have all of your senses about you, if you are intoxicated. And also many of my teenagers are learning to drive, and driving and drinking obviously don't mix. And we talk about the safety with that. Again, making a smart, healthy, safe choice and designating, who is going to drive and making sure people are doing the right things.
Well, and then I really want to talk about marijuana too, because I think sometimes feel that it's whatever. And of course, there's an issue with driving and marijuana too, although usually that's the person that's going like 10 miles an hour. which is also problematic, right?
Dangerous, which is
But,
dangerous in itself.
uh,
Yes.
but I want to hear your perspective as more and more states and cities are decriminalizing marijuana. What do you think is a safe age from the standpoint of brain development? Not that we're endorsing marijuana, but what age should not be touching marijuana?
Okay, the brain isn't even fully developed till 26. So that's even after I have, launched them into the world at 21. Okay. So really, I think I don't agree with it at all for my patient population.
Yes. Well, during the pandemic, I'm so sorry to say that two of the young people, they were in college, because I don't think that people get that marijuana can unmask or accelerate schizophrenia and bipolar. They
Yes.
ended up in the hospital, right? And that's something that is very hard to undo. Because once it's triggered, it may be triggered for the rest of their life. So there is, marijuana for anybody less than 26. I just really, it's such, and I think we're going to be seeing the consequences now that it's sort of available, and a kid can walk in, 10-year-old and get a gummy or a brownie.
Right.
There's no kinds of rules or regulations, and I think that parents or family members, those conversations really, really need to happen. And one has to get educated as to what's out there, right?
And that is something else I also focus on with my parents, and talking to them about having the open lines of communication with their child and being involved in their lives and their friends' lives, making sure the friends that they have around them are positive influences. Right. And just making sure that they are available, because oftentimes when children are looking for these outlets, it's because they're not finding what they need to support them at home oftentimes. And so I think the lines of communication and talking and connecting with your children, going back to the family dinner table and not just eating in front of the TV or eating by yourself or on social media while you're eating. No, come back together as a family, sit around the table and let's talk about things, what's going on in your world and how can I, be supportive. So I always ask my patients, tell me some of the people that you can go to if you have a concern, and what are you doing if you feel overwhelmed and you don't have to solve problems by yourself. We're all here to support you.
Well, there's a couple of great comments that's coming. So Will McPherson, he's in Virginia, and he said it's legal here, and I just caught my 17-year-old smoking, and so we'll probably have to try to have some understanding about what started the smoking behaviors and why it's continuing. And then Yvonne, who's watching on YouTube, she says that also celery helps with blood pressure. And then she mentioned, and this is something that I want to ask you about, Dr. Gigi, being in the DC area. Ever notice in poor communities in Ward 8, there's no grapefruit? And I think what she's alluding to are food deserts, in particularly in urban areas.
Yes.
And that's a terminology for those that don't understand what a food desert is. It's areas, particularly in urban centers where there's a high concentration of Black and brown individuals, where there's not enough stores that have fresh fruits and vegetables that are attainable, and they're within, they're 10, 15, sometimes 20 miles away from the neighborhood. And when you have lower transportation and things like that, it's harder to get it.
Right.
So that's considered a food desert, where you have just the bodega, the convenience store that are filled with foods that are high in preservatives and sugars and salt and all these things that are bad for us. So so let's speak to this food desert first, and then we'll come back to the marijuana.
Sure. So there's food deserts and food swamps, right? Okay. So when I drive, through Southeast in Ward 7 and 8, there may be fish, fried fish and chicken, or if you go to a corner store, I have never seen so many brands of potato chips in my entire life. And the sizes of the beer cans are not just the regular beer cans that they, sell in the white sections, but they can be much, much bigger. And
16, 24 ounce, 40 ounce.
Exactly. Yeah. So in Washington, D.C., in Ward 7 and 8, which is about 200,000 people, there are 3 grocery stores. And there's a fourth one that's coming up, and that's because of the activity and the advocacy and the leadership in the community to bring that fourth one. It's actually, I think, some place from Philadelphia. It's one of the places. But the other thing that I think we don't do enough is to grow our own fruits and vegetables. And it doesn't have to be anything big. I learned something. Did you know that, with food stamps cover seeds. You can actually use your food stamps to buy seeds. So mints, tomatoes, cucumbers, and what has been shown, actually, studies show that if a family invests in growing, they can actually make a little income from that. So in Ward 7 and 8, a lot of the leaders, whether churches or community centers and so forth, are teaching people, again, because I'm going to come back to that in a second, how to grow fruits and vegetables. Because you know what? Anacostia or Berry Farm, which was the Berry Farm tobacco plantation, and after the Emancipation Proclamation, the freedmen were given 400 acres. Guess what? That was a farming community. So the idea that, Black people, don't eat fruits and vegetables, that's just ridiculous. It's not true. And when some of the groups that actually partner with the corner stores and say, we will go ahead and sell, bring the vegetables to you and fruits, and don't worry about your, you stocking them, and you can make the profit. Guess what? They sell in 1 hour. They sell out. So there are lots of myths that are just not there, but I'm so happy to see trends. There's something called is it called the 11th Street Bridge, where they plant under a bridge. I mean, some just really innovative things. Community gardens. Thank you, Ms. Smith. Just some wonderful, wonderful work. So yes, there are these deserts, and yes, there are these swamps, but the people are really doing well. And this is also a great way to engage children. This is the way to teach them about science and, growth. And it just focuses children, also gets them away from these things.
Right.
Ooh. That's a whole nother show.
Another talk on that.
That's a whole nother show.
I know. When they're in my office exam room, I say, please put your cell phone down. We have to focus on your health. That exactly. That's not allowed. Give the phone to your mother. That's the only time the mother holds the cell phone. Give the phone to your mother. Yeah. But
I think, all right, so Yvonne also mentioned that meditation should be used instead of marijuana. And that's a great kind of segue to understanding. I think, for the brother that talked about, he caught a 17-year-old. I think for parents, what we have to do is not have the overreaction, right? So that there's this tendency to overreact, and what that tendency is when we're having a teenage brain that has, Dr. Lang can talk about it, that's got an underdeveloped frontal lobe. What that can do is that overreaction from the parents can actually push them further to more rebellion, right? I'm going to do this. So I would think the best way to handle that, even though you might not, it may really bother you, is to sit down and have a conversation, right? And then get to the impetus. Is this something how did it get started, right? What made you feel like, in our relationship that was okay for you to engage in that behavior? Because there's something that understanding that unless you said that was okay, something in the messaging said, hey, that they made that decision even though they knew that you probably weren't going to be happy with them doing that. So that's a breakdown in that relationship. More so, the marijuana is a symptom, but really what we need to do is focus on what is that relationship and why is the child feeling like it's okay to break these rules that you probably have in place. So really have that discussion with your child and talk about. And then what I did when I was running my groups with kids is I would put on the board and I'd say, okay, give me the benefits. And we would list down one side, what are the benefits of smoking marijuana? And what are the things that are detrimental? And everyone, and these were all marijuana smoking kids, and that detrimental list was so much longer. And I would ask the question, well, why are you still doing it?
Mm-hmm.
The answer for that. And so that was way, because engage them in that conversation, so they feel like the decision, even though they made the decision to start, that decision to stop must come from them, because if it comes from you, that's not a sustainable model as a parent.
So can I share two stories about parents' reaction? Of course, I was the goody two shoes. I was the oldest, so this does not apply to me. I'll tell you about my sister first. So my sister, middle child, kind of wild in school. She's now the parent of 5 kids. So that was the revenge, I guess, for her being wild. Anyway, so one day she called my dad and said the police are outside. And so my dad, Egyptian accent, "Are you high? Have you been smoking marijuana?" So he goes and picks her up from school. Meanwhile, my mother had found out that this is going on. My mother's way of dealing is exactly the overreaction, right? So my mother was fit to be tied. So my dad and my sister come home, and my mom is standing there, and my dad says, "Go upstairs and sleep off your high, and when you're done, we can come down and we can talk about it." The idea is, it was a pause for my sister, but more importantly, it was a pause for my parents.
Yep.
And then my other story relates to my brother, and he had gone out with these not good people and came back, had been drinking. So my dad asked him, "Were you drinking?" And my brother, of course, thought for a second and said, "Yes." So my dad says, "Shake hands. I like your honesty." And again, yes. So to your point, Mr. Ellis, about having the lines of communication open. Of course, they had a conversation later about, drinking and alcohol and all that kind of stuff. But it's very hard. I'm not a parent myself, but I am an auntie to 5, and inside you're screaming and you want to pull out your hair out. But to your point, it's, I think, just be checking your own reaction. Easier said than done. I'm not gonna lie.
Yes.
Right.
Yes.
But I
Definitely.
think that the connection is critical, and that's why I try to encourage that bond formation between the parent and child early on, even from when they're infants, and the connection that they have there through all the different stages. Pediatrics is quite complex, from newborns to toddlers to young children to teenagers to young adults. The whole gamut. You don't wait till they're going off to college to start a relationship.
No, but I liked what you said, Dr. Lang, about asking them, who is that one person that you can go to? Because it doesn't always have to be a parent.
Sorry.
Right. So, as I say, as the auntie, I guess because I'm a physician also, my nephew called me, "Auntie, the condom broke." I'm like, "Okay, this is what you can do." But, I'm so glad that he did, because he felt that it was safe. So it doesn't matter who that person is, whether they're blood related or not, but somebody that they can go to. And what I tell my, especially my girlfriend's kids, I have a friend whose son is starting college. I will actually call him, and I said, like, I am your get out of jail free card. If you're in any kind of trouble, I don't care what time of the day or night, you call me. And that's what we did with my niece. And I got called at 3 and 4 in the morning sometimes to go pick them up. But you know what? I'd rather that. So I think it's also about forming a group, not just because it's hard. Just the parents.
Well, it goes back to the saying, it takes a village to raise a child. And I always say that. I say, I'm a part of your village, your parents, your, aunts and uncles, godparents, your coaches, teachers, guidance counselors, therapists. We're all a part of that village. I say, you don't have to solve things by yourself. And to the point earlier about the meditation, I always encourage my patients to do mindfulness practices. And I have shown them how to do deep breathing practices, meditation, creative visualizations, stress management techniques. So I think that's important too, to take nature walks, to write out journal out their feelings. Some are quite good artists to draw out their feelings, to listen to music. I even have doTERRA essential oils in my office that because you want to just get all the senses involved, right? Just to help with calming and to figure out what you can do to stay balanced.
That's right. Lavender works. And to your point about meditation, so transcendental meditation has been introduced to a lot of schools. And in those schools that have adopted it as a school, guess what? Behavioral issues go down. The teachers are better. The kids are focusing more. So that's so important. And then actually there was a study, I think it was in New Zealand, where they increased recess to 3 times a day. Guess what? The children did better.
Right. The exercise. Yes.
And just getting out and getting that, so
great.
So important.
It's such a, you're right, because that mindfulness practice, I think that will help the parents, and so they don't have that overreaction. Dr. Gigi, you talk about creating a safe space, right? Any relationship requires safety in order to be vulnerable, in order to open up, right? So even if you're in a romantic relationship, your spouse, your significant other has to feel safe in order to open up. Your child has to feel safe with you in order for them to open up. So if you're always criticizing, if you're hypercritical, if you're you're jumping off the deep end every time that something goes wrong, they don't feel safe anymore with you. And so therefore that becomes hiding. And then that's when we start having behaviors that are kind of counter of what you would want them to do. So we try, and I'm not always successful, but we try, to do that, to have that space. And we had that conversation with my daughter, who's 4 now, and I said, hey, look, if you ever find yourself in a situation, we're going to be upset. I'm going to tell you right now, we're going to be upset, but we would rather come pick you up that night. We'll talk about it in the morning versus having to pick you up from the hospital or from the jail. And so that's the compromise that you sometimes you have to make as a parent. Because you can't draw that hard line. Kids make bad decisions from time to time.
Yes.
We give them the tools to make better decisions, but we also have to give them the safety and the space to where if they make a bad decision, they're not going to view it as being catastrophic, because that can have consequences later on in their lives.
That is something else just to bring up briefly, the fact that a lot of times children are constantly hearing negative feedback from the parents.
Yes.
So I try to, in the visit, I even ask the parents, so if they have been kind of complaining about X, Y, and Z with their child, I say, okay, let's address that. But now, can you give me 3 positive things about your child? So they hear it right then in real time. And then I also ask the child, what are 3 things you're grateful for? And, just trying to circle back and focus on gratitude and what brings them joy. And so I try to bring that into every visit too, because it's not all about what you're doing wrong. Like we said, they will make mistakes. And I say that no one's perfect. We're all human.
Right.
I do have a Krispy Kreme donut every now and then. Okay.
Especially the hot donuts now is signed as on board. When it's lit up, that's like the bat signal. I got that.
But it's important to make sure we focus on the positive, because the child will repeatedly think about the negative feedback loop, and that affects their self-esteem, and then that affects their choices that they make and their communication lines with the parent. They don't feel as comfortable. So, I try to bring all of that into the visit. So that's why my visits are quite long, but it's worth it.
Well, it is worth it. And that's why you're so beloved. And that's why you've got a wait list of people to see you, because you are really dealing in a holistic way. And it makes it easier when the kids come to me as adults, because you have really spent all that time with the kids.
And for the foundation years is the critical.
Yes, critical.
Yeah.
When we're teaching, let's say students or residents or other people who teach, we always talk about the feedback sandwich, that we start off with something positive, and then you can put the not negative, but the constructive criticism, and then something positive. It's very, very hard. And I think, one of I think it was Miss Yvonne that mentioned, spending 20 minutes time with each child. I think parents are so stressed, and there's so much pressure, and the speed of life, my God. I mean, when we were growing up in Michigan, the summers were off, we could hang out at home or play outside or whatever. Now there's this sense that, kids have to be entertained all the time, and then this thing becomes really the substitute.
Right.
But I think, just like anything else, that whole thing about when you're on a plane and, the oxygen masks you put on yours before you put on the child's. I think it's important to be child-centric, but in being child-centric, you have to take care of yourself.
Yeah.
Because if you're flying off the handle, that's not good for you, your blood pressure or your mood or any of that, or your child. If you're not sleeping, you're going to fly off the handle more, right? So, and let's just be honest, this has been a couple of years of just real tough stuff.
A lot, yes, for sure.
So, Dr. Lang, I have a question about social media and mood. Can you speak to that connection?
Yes. The social media is a problem, and it's a problem on so many different levels because children, it affects their self-esteem. It encourages eating disorders. It attributes to depression and anxiety and the whole comparison perspective. And it really is addictive and takes up a lot of time that could be or they could be doing something more productive, or just resting, like you said, or just kind of having time just to be and not always doing something. I just want to go back just to a quick moment, what you said about the self-care of the parent. That is something I also emphasize, and I think that's critical because the parents, one, they're worried about, am I doing a good job parenting, but then am I also taking care of myself? Like it's a dichotomy there, and it really has to be something that is an intentional focus because for example, I had a mother the other day, she said, I noticed that her birthday was coming up too. And I said, oh, your birthday and your child's birthdays. She'd say, oh yeah, it's just my child's birthday. I said, no, it's your birthday too. You should celebrate your birthday too. You are important too. Don't lose yourself completely. And your child, yes, you are a mother, but you are, more than that too, right? And not to lose yourself and to take care of yourself and to go celebrate yourself too. So I think the self-care message is critical too. And I actually have someone, Dr. Jatu Sinesi, she has her company Essence of Strength. She does self-care consultations for my parents, and then just to help them kind of refocus on, good intentions for themselves. So,
well, we're messaging our children all the time, right? So if we come in and we're stressed every day and we go to the liquor cabinet and we pour ourselves a drink or pour ourselves a glass of wine and we sit down, we're sending that message that's how we de-stress, right? And so that child picks up that messaging, and I can speak directly to that because that's how my father, and he would drink and drive. He'd pour a glass of scotch and get in the car. And so I never thought that drinking and driving was bad because that's what I saw every time as a child when we went on car trips. So we're sending messaging. So when you're talking about self-care for parents, if they start demonstrating that at home and then also doing it with the kid, with the child, we're sending that messaging that self-care is not only important, but it's a practice that we should both do. And so that becomes a habit that they develop very, very early on. And we understand that the earlier that we can develop a habit, the more ingrained it becomes as part of their lives, particularly in that mid-range of ages 7 to about 13. If we can get those habits formed during that critical time frame, then they have a better chance of having it sustainable throughout their lives. That's statistics. That's not just Ellis talking. That's statistics talking.
Yeah, absolutely. I agree.
Those habits of healthy eating, those habits of self-care, those habits of understanding, speaking, finding their voice and speaking up for themselves, defending themselves, whether it's with their peer group or with other adults, and being able to speak out and feeling comfortable doing that, those habits will help our great great habits to have as an adult. And so those are the things that we're trying to work on with our parents. As we're wrapping up here, because we've been on it for about an hour, so we've got to make sure that we're reminding our parents, if you have been missing your child wellness appointments or whether they've been missing their immunization appointments, now is the time. They can't. I'm sure most places are going to be in-person school this fall. You need to get those things done. We're not going to talk about COVID, but COVID is a personal decision. But I would suggest that if you're going to, when your child is if they're eligible, and now everybody's eligible, if they're going to be in a school setting, please consider getting it done. Talk to your pediatrician about getting vaccinated, because we know this, that the numbers that we see that are reported in the news and on television are lower than what's really going on, because people are self-testing at home, and not every medical agency is reporting to the CDC. So what you see at the CDC, those numbers are lower in terms of cases, and so they're going up. So please, if you're not vaccinated, consider getting it done for yourself, and also consider it getting done for your child. Get caught up on the immunizations. Make sure you see Dr. Lang, get that physical done. She's got a waiting list, so you got to see somebody else.
It's okay.
You can go see Dr. Lang, but make sure you get those physicals done. It's not just for sports, but it's just for your child.
Every year.
Yes.
And get yours too. I just scheduled my dental appointment today. You know what I did right after that? I scheduled one for my son, right? And so we're going to go. He's going to go to a pediatric dentist. I got to go to the grown folks dentist, but we're both going to the dentist. And so these are the type of habits and behaviors we have to engender in our children.
And as we close, this was meant to be children and adults, but obviously
part 2 for adults. I already figured out.
We're going to have a separate one because this was Dr. Nicole. You were just so wonderful in bringing up so many topics.
Yes.
And I just want to say to any parents, whether you're their biological parent or grandparent or in a parenting role, please give yourself a break. There's a lot of blame that happens on parents, and they're, when something bad happens, it's it's pointing to the parents. And this is what I say: you're doing your best, and sometimes your best is different depending on what you're going through. So don't beat yourself up. Tomorrow is a new day, and you can start again, and then reach out for help. There are ways that you can get help. I think one of the things in DC, certainly and in other cities, there's a lot more help and a lot more resources than you might imagine. 311 is a number to call, which can actually connect you. Yes, give yourself some grace.
Yes.
I love that. Well, I'm going to stop talking, and other than to say thank you, Dr. Nicole Lang, for such a wonderful show. Thank you so much, and for all the things that you do for children and their families here in the District of Columbia. Thank you.
Thank you for having me.
That makes me want to move to DC to bring my child to you. So you have been fantastic. Thank you all. I want to thank Yvonne. She has been really holding down the comment section and just adding so wonderfully to this program. So I want to give her a special shout out to everybody who's watching us from around the world. You saw Nigeria. We saw the Caribbean. We saw everything in between, Texas, Chicago, everybody. So thank you all for dropping that in there. We're going to replay this in the morning. So if somebody's missed this, we're going to re-air this in the morning. Please, if you know somebody that has children, let them see this program. Share this program with them on your page. Put hashtag house call, BDO house call. You can put that on there. Let them know that we sent you. This is a wonderful program. Part 2 is going to be for adults, because there's a number of screenings you have to have as an adult. Once Dr. Lang jettisons you off at 21, guess what happens? You got adult stuff you got to get done, right? So
you come to me.
We've got cancer screenings. We've got all types of screenings that are going on as an adult. So we're going to be talking about that in part 2. So in 2 weeks, check us out here, House Call with Dr. Gigi. We're going to be doing part 2 on the family summertime checkup. We got to get back on track. We lost 2 years of our lives. We got to get back on track to make sure that we are healthy, wealthy, and wise. Until then, we'll see y'all next time.
Thank you.
Bye-bye. Thank you.